The National Union of Public Service and Allied Workers is set to gather this afternoon for an Indaba at the Chris Hani Baragwanath Hospital. The union plans to meet or discuss how it will further mobilise its efforts to have temporary health workers absorbed as permanent. Our reporter Katleho Sekhotho is there. Katleho, good afternoon. What can we expect to hear coming out of this Indaba?
A very good afternoon, Hugo. Indeed, we are here at the Chris Hani Baragwanath Hospital, and NUPSAW as a union, as workers' union, is gathering to discuss the issue around EPWP workers and all health workers who are employed currently on contract, and their fight is about having those workers permanently absorbed into the health department. Now, NUPSAW is not new to this fight. They have been calling for, especially COVID-19 healthcare workers who were temporarily contracted, to be absorbed into the system, as well as EPWP workers. And this Indaba is about the union looking at ways to mobilize in the near future and making those calls towards the Gauteng Health Department. But to get more and to get the facts, I have with me the General Secretary of the union, Soli Malema. Soli, thank you so much for speaking to us. Just give us a brief overview of why you're gathering here today and what you're going to discuss as a union.
Well, thank you very much. Why we are here, we are implementing founding principles to formalize the informal sectors in the public service, because as NUPSAW we view that as an exploitation. Now, Gauteng Department of Health has been exploiting these workers for many years, and they made several attempts to dismiss them. We have defeated them. We'll continue to defeat them. So this gathering is basically to take resolutions of a permanent employment so that we go back to the department and now demand permanent employment with immediate effect. So we don't want these extensions. We are going to make sure that this is the last time they extend. Now, between the end of this financial year, we need to finalize the issue of absorption. 2, these workers are occupying funded positions. So we are saying to the department, and we are saying to Panyasa Lisuf, make sure that you appoint these workers permanently, because where they are working, those positions are funded. What they need to do is to do the right thing and make sure that they appoint them to those positions. Then secondly, we have noticed that these politicians are using this program to steal monies, because we have just discovered that because they are saying there are about 3,900 EPWPs, but that is not the case. We're suspecting ghost EP workers within the system, and we are going to do an investigation, and people will account.
Yeah.
Thanks.
What have your conversations with the health department looked like so far? I imagine before this Indaba, you've tried to engage them, you've tried to hear where they're coming from. What do those conversations sound like with the department?
To be honest with you, we are making progress. We met MEC Mamabolo, the Premier for Gauteng also intervened. We are making a progress in terms of making sure that these workers are absorbed on those positions, especially those that are funded. But I must say, we're also looking at other sectors like your early child development, your community health workers, that we are playing a major role in terms of making sure that they are absorbed into the public service.
And if you are deadlocked in your conversations with government, does it mean a strike is imminent? Does it mean halting of services in the near future?
Yeah, as much as that will be the last resort, but definitely we'll go in there. And I must say, we are not going to embark in this war to lose. We are going in this war to win. And we have more strength across the country, the CHWs, the EPWPs. We don't fight to lose, but we fight to win.
What else are you demanding besides the absorption? I mean, is it also higher pay? Are there other things on your memorandum of demands?
Remember, if we achieve that objective, automatically the workers will get benefits that all public servants are getting, like the CSWs in Gauteng. We waged that war and we won it. They are now getting the benefits that public service are getting.
Thank you so much for your time, Mr. Malema. Hugo, there you heard it from the General Secretary of NUPSAW, Soli Malema, just explaining this Indaba today and the agenda on the program to discuss the absorption of workers within the healthcare sector as permanent staff. We do know that COVID-19 workers in particular were laid off after the pandemic subsided, and also alleging, EPWP workers not being given permanent employment, or at least their contracts being constantly renewed. And they're saying they want these workers to be permanently absorbed in the system. Also alleging that there may be ghost workers of EPWP workers, and their aim to deal with this, and they want to continue engaging government, especially Premier Panyaza Lesufi and all the officials in the Gauteng Health department.
Kat, that paves way for my next question before we let you go, and is that, do we have representative from the Premier's office? Because obviously the issues that Soli Malema has talked about have an impact, and are they part of the Indaba? Are there other parties outside of NUPSAW itself and its members?
You know what, so far, no, I haven't seen an official from the health department or even from the Premier's office, but I will engage with the leadership of the union to find out if they will be coming, throughout the day, or have they engaged them so far about their Indaba, and will they be taking part in at least responding to their needs. So far, not so much, but we will be engaging with them to find out, will any department officials or government be here today.
Katleho Sekhotho coming to us from the NUPSAW Chris Hani Baragwanath Hospital, where they're having that Indaba. We will be catching up with her this afternoon to get way on deliberations and certainly some of the issues that have been discussed during that Indaba. Appreciate your time this afternoon.